Suicide prevention is a collection of efforts to reduce the risk of suicide. These efforts may occur at the individual, relationship, community, and society level. Suicide is often preventable. Beyond direct interventions to stop an impending suicide, methods may include. General efforts include measures within the realms of medicine, mental health, and public health, because protective factors such as social support and social engagement, as well as environmental risk factors such as access to lethal means, play a role in suicide. Suicide is not solely a medical or mental health issue. Means reduction, reducing the odds that a suicide attempter will use highly lethal means, is an important component of suicide prevention. This practice is also called means restriction. It has been demonstrated that restricting lethal means can help reduce suicide rates, as delaying action until the desire to die has passed. In general, strong evidence supports the effectiveness of means restriction in preventing suicides. There is also strong evidence that restricted access at so-called suicide hotspots, such as bridges and cliffs, reduces suicides, whereas other interventions such as placing signs or increasing surveillance at these sites appears less effective. One of the most famous historical examples of means reduction is that of coal gas in the United Kingdom. Until the 1950s, the most common means of suicide in the UK was poisoning by gas inhalation. In 1958, natural gas was introduced, and over the next decade, comprised over 50% of gas used. As carbon monoxide in gas decreased, suicides also decreased. The decrease was driven entirely by significant decreases in the number of suicides by carbon monoxide poisoning. A 2020 Cochrane review on means restrictions for jumping found tentative evidence of reductions in frequency. In the United States, firearm access is significantly associated with increased suicide completion. About 85% of attempts with a gun result in death, while a number of other widely used suicide attempt methods result in death less than 5% of the time. Although restrictions on access to firearms have reduced firearm suicide rates in other countries, such restrictions are difficult in the United States because the Second Amendment to the United States Constitution limits restrictions on weapons. Crisis hotlines connect a person in distress to either a volunteer or trained staff member. This may occur via telephone, SMS, online chat, or in person. Even though crisis hotlines are common, they have not been well studied. One study found a decrease in psychological pain, hopelessness, and desire to die from the beginning of the call through the next few weeks. However, the desire to die did not decrease long term. In the United States, the 2012 National Strategy for Suicide Prevention promotes various specific suicide prevention efforts, including recommendations around media reporting of suicide include not sensationalizing the event or attributing it to a single cause. It is also recommended that media messages include suicide prevention messages such as stories of hope and links to further resources and services. Particular care is recommended when the person who died is famous. Specific details of the method or the location are not recommended. There, however, is little evidence regarding the benefit of providing resources for those looking for help, and the evidence for media guidelines generally is somewhat mixed. TV shows and news media may also be able to help prevent suicide by linking suicide with negative outcomes such as pain for the person who has attempted suicide and their survivors, conveying that the majority of people choose something other than suicide in order to solve their problems, avoiding mentioning suicide epidemics, and avoiding presenting authorities or sympathetic ordinary people as spokespersons for the reasonableness of suicide. The medication lithium may be useful in certain situations to reduce the risk of suicide. Specifically, it is effective at lowering the risk of suicide in those with bipolar disorder and major depressive disorder. Some antidepressant medications may increase suicidal ideation in some patients under certain conditions. There are multiple talk therapies that reduce suicidal thoughts and behaviors, including dialectical behavior therapy, cognitive behavior therapy for suicide prevention as a form of DBT adapted for adolescents at high Risk for repeated suicide attempts. The brief intervention and contact technique developed by the World Health Organization also has shown benefit. The World Health Organization recommends specific skills should be available in the education system to prevent bullying and violence in and around the school. Coping planning is a strengths-based intervention that aims to meet the needs of people who ask for help, including those experiencing suicidal ideation. By addressing why someone asks for help, the risk assess